The 8 bones of the carpus are arranged in 2 rows of 4 bones, a proximal row which articulates with the radius, and a distal row which articulate with the metacarpals of the hand. If we were to identify the 8 carpal bones, starting off with the proximal row on the lateral side, which is the thumb side in anatomical position, the first 2 bones, the scaphoid and the lunate, are very important. These are the bones which articulate with the radius at the wrist joint, and it is the scaphoid which is the only carpal bone broken in most wrist fractures. Finally, the triquetrum and the pisiform are also in the proximal row. The pisiform is only visible on the anterior surface of the palm, and we often refer to it as the heel of our hand. The trapezium is the first bone in the distal row, once again starting on the lateral side. It is extremely important because it forms a saddle joint with the metacarpal of the thumb, giving us very dexterous thumbs. The other bones of the distal row are the trapezoid, capitate, and hamate bones.